Everyone, we're now live streaming to YouTube, across YouTube, Facebook, Twitter, X, and many other platforms. We're here from at the Geneva Learning Foundation now in Argentina with Maria Monzon for the very first time. We're here with Charlotte Mbou from Cameroon and myself, Rida Sadki from Geneva, Switzerland. So spanning 3 continents, and in the room with us is actually an amazing group of organizational leaders that we met on the 4th of April as part of Teach to Reach 10. We launched a call for local organizations and leaders of local organizations. We realized that many of the tens of thousands of Teach to Reach participants are also making a difference in their communities. And for the very first time, we're opening up Teach to Reach to you as leaders in your communities. And Teach to Reach itself is in June, but as we count down, we're going to really be able to we want to get to know you, and most important, help you get to know each other. So we have this slide for Charlotte. We need one for Maria. Charlotte, how are you doing? We're just, we've got, a minute, 13 seconds for you to introduce yourself.
Hi, everyone, and it's great to connect once again. I'm Charlotte Mbou from the Geneva Learning Foundation, connecting from Ebolova, Cameroon. And it's great to see the engagement of so many organizational leaders from across the globe coming to share with us their important challenges and what they are doing to address these challenges in their communities. Thank you.
Indeed. Thank you, Charlotte. And we're still in our Zoom studio here, but we're also live streaming across all these different platforms. So we're looking forward to seeing your messages and comments. We can see them at any time. We're now 30 seconds away. We're also going to take a look here in the, 25 seconds. All right, so this is a bit of a risky endeavor. Let's see. Okay, here we go. There are some... some messages. Kenise Chisholm, I believe, I don't know if no one else has reported audio issues. Check your audio, and also, most crucially for everyone, please do check your... All right, and here we go. All right, starting up with a little of South Asian beat, I would say, for this check-in for Teach to Reach partners. So we'll do these once a month. So there's one left until the actual event, Teach to Reach 10. In case you don't know what this is, look in the description, wherever you're watching on YouTube or Facebook, look in the description. You'll find all the links to find out more about what is Teach to Reach Connect. So Teach to Reach Connect is really the Geneva Learning Foundation's event to connect health professionals and help you meet, network, and learn together. And today we are, I believe, 44 days until Teach to Reach 10 in June. Now, before we go any further, I do want to ask Charlotte to say a word about what's happening tomorrow. Charlotte, why are we sharing with Teach to Reach participants that tomorrow is a big day for everyone who works in immunization and primary healthcare?
For 3 years in a row, we have been organizing these special events just to honor immunization and primary healthcare professionals working in the domain of vaccination through special events. And this year it's quite particular because we are celebrating 50 years of the EPI program. And so you definitely want to be there with us tomorrow for these special events. Over the past month, we have been collecting spectacular photographs of the difference that frontline health workers are making as far as immunization is concerned. And some of these photographs have been shared already on our social media platform, but lots and lots of them are still available, and we will be showcasing some of these tomorrow, but most especially listening to the experiences of frontline health workers on what they are doing to reach every child, every community with much needed vaccines.
Great, thank you, Charlotte. All right, so let's now hear from the organizational leaders in the room. We always kick off with your voice by turning to you those of you who are with us in our Zoom studio, for those who are watching across social media, please share your comments. We'll share your comments, and you're welcome to respond to these questions. So I'm going to turn here to Maria because she had been discussing, we'd already heard from some of the organizational leaders before we even started the session. Maria, who would you like to ask this question to first? Why does your organization wish to become a Teach to Reach partner? I'd like to suggest that we hear from a pillar, while Maria thinks about that, from Professor Becky Tagbo. Professor Becky
Well,
Tagbo.
I was gonna ask too, so we're on the same path. We're good.
Okay, wonderful. And there are voices you will hear frequently if you come to our events, and we honor these very leaders, elders in our in the Teach to Reach community. A warm welcome to you, Becky. You are, of course, from Nigeria. Do introduce yourself. We know you as an individual, as an exceptional leader in the movement for immunization agenda 2030, amongst many other accomplishments. Introduce this time your organization, and why does your organization wish to become a Teach to Reach partner?
Hi, Reda. Hi, Charlotte, and everybody on the call. Happy to join you. Yes, I have been here as an individual, but also as with my organization. And my organization is the Institute of Child Health, University of Nigeria Teaching Hospital in the southeast part of our country. So my organization's kind of agenda and motivation and objectives really align with the Teach to Reach. And so why we want to partner with you is because we have similar vision, and that is to save lives, especially through immunization, especially at the grassroots, to reach out to the individuals at the grassroots and those that are unreached, and also sustain those that are being reached. So we want to eliminate the expanded explanation of zero dose, not just the absolute zero dosers, but also the incomplete immunization. We have a lot of them. And so through advocacy, through awareness, and celebration of immunization-related days, it affords my organization the opportunity to expand. You know, when you work with other people all over the world, you are kind of motivated, and your capacity kind of multiplies than when you are just working alone, one lone organization in one corner. Or when we do it together, it kind of explodes. Yeah.
Thank you very much, Becky. Wonderful to hear your voice. And I don't see any other microphones unmuted. So, Maria, the good practice is to actually unmute before we turn to the individuals. Who will be next? Who shall we hear from next today? To answer this question, why does your organization wish to become a Teach to Reach partner? Maria may be having connectivity problems. I see her microphone is muted.
No, I'm now here.
Okay.
Sorry. So I wanted to invite Dr. Nelson. Nelson from Kenya.
Right.
If you want to tell us why you're here and introduce yourself. Reda has shared some of the questions. I had invited you to unmute.
All right.
Dr.
He's
Nelson.
not unmuting. So let's go to Anna Miti. Let's try Anna Miti. Blaise Bagiluku, we're asking you to unmute and tell us why your organization. First of all, tell us what is your organization, what does your organization do, but also to tell us why you are interested in becoming a Teach to Reach partner. So your microphones, if you've heard your name, that means you're now able to. Okay, Anna Miti is the first one to respond, and you'll see there'll be a lot more, many more opportunities for you to speak. So check your equipment, check your connectivity. Anna Miti, lovely to meet you. Please introduce yourself and your organization, and then tell us why does your organization wish to become a Teach to Reach partner.
Thank you so much for that. Anamit is my name. I am the project lead for Media Science Cafes that we do as the Humanitarian Information Facilitation Center. So basically what we do is we connect the media with community advocates, with researchers and other stakeholders like government officials, so that people are aware of the humanitarian issues that are happening in their communities. We are particularly interested in health and climate, as well as including SRI, HRI, and HIV. We believe that communities can make a change if they are informed, if they are aware of the things that are happening in their communities, and they actually have solutions to the challenges that they are facing. So teach to reach for us is it's potentially a very important thing that we could do. With enough support, with enough information, going out to communities, talking about these issues, and hopefully bringing a change at the end of the day. When we do our activities and when we connect communities with the people that are supposed to be policymakers, also with the media, because the media gets to highlight all these issues. You find that we have got advocates in our communities, but they don't even know, how do I go to the local television to speak as a guest? But if we bring the media to them, they get to be quoted, they get to be in the limelight, they get to talk about those issues. And that also includes even advocates. So in a nutshell, I could go on and on. So in a nutshell,
thanks, Anamidi. And we know all of the leaders of organizations. If you take your time when you could be doing other things, entertaining yourself in various ways, and you choose to dedicate time to improving the state of your community, trying to do something for your community, we know that makes you a very special person, and that you are likely to be passionate about these issues that you care about. And these are the voices, this is a passion that we hope to bring to Teach to Reach. Letsatsi Phineas Lekua has a hand raised. So Letsatsi, can't wait to hear from you. Do tell us very quickly what your organization does, where you are. Anna, if you could tell us in the chat where you're based. I don't think you told us, and if it's a regional or country. And Letsatsi, do introduce yourself. Why does your organization want to become a Teach to Reach partner?
Okay, thanks so much. My name is Letsatsi Lekua from Lesotho. I'm the member of the Internet Society Lesotho. We are working on connecting the unconnected communities. We are working on climate change education and technology education. We are having more than 156 ICT experts across the country, helping the communities to understand more about digital rights and digital protection, and also in terms of cybersecurity. And also we are helping the communities to understand the health applications and on how to use the application for them to access the health facilities also. So yes, I think it's important for us to be part of the Teach to Reach as a partner. Thank you so much.
Okay, wonderful. And you haven't told us, have you participated? Will this be your first time participating in Teach to Reach?
It is my first time. Yes, it is my first time.
All right, wonderful. So warm welcome to you and to all the others for joining the Teach to Reach family for the very first time in June. Remember, we're now 44 days away and counting down. Each day counts. In fact, stay with us right to the end, because we're going to share some very practical activities, some things you can do and take action right now to spread the word about Teach to Reach, to the benefit, of course, of your organization as a Teach to Reach partner, but also to really growing this community. The more people share their experience, the more people share what they're learning, the more likely we are to make progress. We may need to take a step back here and actually tell you what is Teach to Reach Connect. So this is a regular event initially was focused on immunization. It is still, and allow me to reassure those of you who are immunization professionals, we're still very much committed, and the immunization and the movement for immunization agenda 2030 will still be at the heart of this Teach to Reach 10. We are expanding to other questions that matter to communities, to local communities, and to health professionals. Now, we've specifically invited those we call local organizations, and I'd like to just recap what is a local organization in the way we define it. There may be different ways to define it. First of all, this means that your organization is based in a community. Second, that your mission is to serve the needs of the community, that it is led by community members and accountable to the community served, Now, where we deviate a little bit is typically when people say local organizations, they mean civil society organizations. But we know that in some countries, it is actually the local government services that are very much community, that are part of the fabric of the community. And in fact, we saw that when we launched a call for local organizations, you're going to see who responded. First of all, this, I believe, is a pretty significant increase. 1,829 participants registered for the partner briefing. You can see 1,195 in English. These are absolutely stunning numbers. These are all, and these are, it's true that the number of participants of Teach to Reach is in the tens of thousands now. But these are organizational leaders, so each one of them potentially represents their membership, their participants, their staff, their volunteers. So this is how we see the way forward for Teach to Reach. And you can see some countries are certainly more represented and active than others. But even if you are the only person representing a local organization from Tajikistan or from Vietnam or from Spain, just to pick the last four names, not to pick on those countries, that places a particular responsibility on you. You are at the forefront of Teach to Reach in your country. Now, I told you we'd have some updated numbers, and thank you to Charlotte for preparing these. First of all, we have now 1,829 organizations represented here that are working through this partnership process. You can see actually almost a third or almost 30% are government agencies, so local government agencies. We still need to figure out what are these other nonprofits, so we'll be asking you more questions about that later. And then you can see that actually what surprised us is almost a quarter are national level organizations, so people working at the whose organizations work at the national level. We still have a gender deficit, so we are 30%, 31% of organizational leaders participating are women. And then we still have predominantly people who have participated in Teach to Reach, which makes me very happy to hear that the first few voices, Maria, that we heard are actually people who've never participated in Teach to Reach before. Now, we have the second question, which is, let me see. We'd like to zoom in. As you know, we are going to be focusing on climate change. And the next question for you is actually both a personal and a community one. So we know many of you are health professionals. And here's a question. We're about to make a major announcement about a major new partner for Teach to Reach. We can't tell you any more today, but we hope to within the coming days. We're very excited to be bringing in a partner that matters in the world of the fight against malaria, and that also means the fight against climate change. So we'd like to ask you now, how has malaria affected you, your family, and your community? And what would help your community in the fight against malaria? So this is different from the first question. I'd like to go to ask Anne-Marie Say. Let's try Kenise Chisholm, Celestine Bendelli. Now, if your life malaria doesn't affect you, feel free to tell us that as well. We have Ojas Ware. And you can still introduce yourself and your organization, but we'd like to hear firsthand how you, your family, your community are being affected by malaria. So let's see if we can invite Nelson Ogero, Millicent Kolande, Mariam Musa. And this includes, of course, there's a new vaccine for malaria that can make quite a big difference. So please raise your hand if you have things to say about this question as an individual, but also as a leader of an organization. James Mugalia from Uganda, would you like to tell us more? And please, all right, wonderful. I'm just asking you to unmute. And this is normal. It always takes a bit of time, especially when we introduce a brand new question. We're about to share what we call Teach to Reach questions about malaria. So this gives you a taste of that. All right, James Mugalia. Let me just show your message.
All right, sir. Okay. All right, sir. Good afternoon to everyone. When I look at the aspect of malaria, it has really affected us. I'm Garia James, representing Divine Touch Children Ministries from Uganda. Malaria, this side has done a lot of more harm than good. We have lost very many young children because of malaria. It has actually even led to poverty, because at the end of the day, we are ever in health centers, we are ever in hospitals looking for the treatment of malaria. As I've earlier told you, that we have lost very many lives. Mature people are dying, young people are dying. So this one is leading to a reduction in the population in the country. So malaria has affected us so much, has affected our incomes in the family. It has affected us. We have lost lives, and really it is affecting the general progress of the country at large. We are trying to look at several measures of trying to avoid it, trying to prevent it, but still things are not working out very well due to the inadequate resources. We look at sleeping under treated mosquito nets as one of the ways of which we can use to try to avoid it. Then we look at also spraying, slashing the tall bushes around our compounds as one of the ways we can use to, but still all in vain. Still there is a higher rate of people who are suffering from malaria, and really it is heavily impacting us negatively, hence leading to underdevelopment in our communities. So that's what I have to say for now as far as malaria is concerned. But really, we need the urgent response towards it to save the lives that are perishing day by day. Thank you so much for the opportunity granted. Thank you.
Thank you very much indeed, James. Now, the reason we're asking this question, and I invite you, if you have things to say in your experience as a health worker, if your organization is working on malaria, please raise your hand so we can come to you. The reason, this is an example of what we call teach to reach questions. And so you'll find on your inbox, as soon as you've requested your invitation to Teach to Reach 10, you'll begin to receive questions to share your experience and become what we call a Teach to Reach contributor. So even though here we're meeting you as organizational leaders, every person, every organizational leader, every participant to Teach to Reach receives these questions, and they're really designed. If you think, James Mugalia, about your experience with malaria and what could you learn if you had also the experiences of individuals, health workers, organizations all across the world in the most severely hit countries by malaria, and you could tap into that knowledge, that intelligence of what has worked, how people, individual health workers and health workers organizations, ministries of health made it work. So really answering Teach to Reach questions, we encourage you to do it as organizational leaders to set the example, but also to invite your staff, your volunteers, your organizational team, the community members to participate in Teach to Reach and to share also their experience. It's really a chance to make a real impact on global health. You're contributing to this rich repository of knowledge. And the way it works is very simple. All you need to do is request your invitation to Teach to Reach 10 today, if you haven't done so yet. If you have, make sure that our emails don't end up in spam, because that's obviously then you won't see the questions, you won't be able to participate, and you won't be able to learn. So that is why we're asking you this question. Let's go. I see more hands raised from Christopher Amalu and from Yamba Josue and from Okech. Michael, if you'd like to answer this question, how has malaria affected you, your family, your community? What would help your community? Maria, if you could, tell me who we shall hear from next. And in the meantime, Mary Juma has sent us message she's connected via YouTube. Malaria has affected my community and family, especially pregnant mothers and under 5-year-old children. Mary Juma, please tell us more. What would help your community then? And I believe, let's see, Christopher
We can
Amalu.
hear from, okay, exactly. Christopher, there we go.
Right. Go ahead, Christopher, and don't forget to introduce yourself and your organization. But be concise. There are many other hands raised. Thank you.
Thank you very much, Radia. My name is Christopher Amalo, the Program Director, Royal Healthcare Foundation in Enugu, Nigeria. To be precise, I am really burdened by malaria, and the impact is so much to myself and my family and the community as well. One of the greatest challenge we have is that for quite a long time, since 2015, in my local state here, we've not had a distribution of the IT end, but God so kind, there's an impact project, the Immunization Plus and the Malaria Progress by accelerating coverage and transforming services that is coming on board. We hope that with that project, we're going to be saturating all the communities with the availability of the insecticide-treated bed nets. It's still posing a huge challenge. Environmentally, there are a lot of places that need to be cleaned so that we reduce breeding sites for malaria. One of the key things I've also done is a work in progress for my organization is that we're building bridges with the Enugu State and the Ebonyi State to see how we can leverage on the services of the community health influencers promoter services, the CHIEFS program, to enhance performance of in terms of the efficiency of malaria. In malaria control. That's something that is ongoing. Thank you very much.
Thank you, Christopher. So, a question for you: your organization is involved in the fight against malaria. Can you tell us how? And so that's first question. Question two is: will you be sharing the Teach to Reach questions on malaria with members and staff, and maybe volunteers in the communities that your organization work with?
Exactly. But basically, what we do in terms of our interventions to increase advocacy, communication, we're exploring opportunities we have with the media. I have been on the media during the World Malaria Day, one of the biggest media outfits, Radio Nigeria in Enugu, to speak about malaria and the need to end malaria. One of the also key things we're doing is to ensure that leaders, health managers, and leaders at different levels are also doing their bit and ensuring that once we have all the systems available and there are accountable systems in terms of when we have the take delivery of the impact commodities that are coming on board. This is what we're doing. Then, in terms of our team, I have also taken made efforts to engage with the executive secretaries and chief executive officers of the basic primary healthcare development agencies in Enugu State and Ebonyi State. Currently, there's a discussion going on, and we made a formal engagement with them to see how we can partner with them to strengthen the capacities of the CHIEFS agents we have in all these communities so that they can actually identify early stages of malaria, refer them to primary health centers, and ensure that community members are receiving appropriate treatment, especially with mother and pregnant women and children under 5. Early detection and also guiding them in terms of identifying safe medicines and what we call substandard or falsified medicines. So these are the key things that this project will deliver to our people, and it's a work in progress.
Wonderful. Thank you, Christopher. One last question for you then. How do you see, where are you going to find the time to answer these Teach to Reach questions? For example, the ones on malaria. You're obviously a very senior leader in your organization, and yet why would you take the time in your busy schedule to actually answer these Teach to Reach questions? What do you see? And then to actually look at what others have shared in terms of their experience with malaria and the response to it. Why would that be worth spending your time?
Well, it's worth spending my time because I'll spend almost all my lifetime in fighting against malaria and HIV. All my academic work is on researches and is on malaria. And currently I coordinate health advocacy and media on partnerships on health in Enugu State. I'm also representing CSO, civil society organizations on what we call Southeast Health Accountability Platform on this State Oversight Committee on Basic Health Provision Fund. So I utilize all the social media platforms I have, and where I reach out to civil society platforms, different networks, like this, all the Teach to Reach programs, all the Geneva Learning Foundation programs are widely circulated in all official platforms that I belong to. So this is what we're doing, and it's spreading like wildfire. And people are acknowledging and thanking me for creating the opportunity for them to learn. And I see a huge success that we're going to be having a lot of alumni from to come on board, especially with regards to the June 2020 Reach the 10 event that is coming up.
Yes, indeed. Yeah. Thank you, Christopher. We hear the energy and the enthusiasm, and we defy distance to do it. You are in Nigeria. There are in the room leaders of organizations from all of the countries affected by malaria, hard hit by this by malaria. And this is just one example, one of the topics. Of course, it is related to climate change. Today's the partner coordination check-in. You're hearing the voices of leaders of organizations that for the first time have been invited to join, to become partners of Teach to Reach. This is a open, massive. There's no other way to describe it. Last time in October, we had 17,662 health professionals from over 80 countries participate. Maria, who shall we hear from next?
Thank you, Reda. Okay, we still have two hands raised. So, Jamba Joshua, would you unmute? I was asking you to. If you're able, there you go. Please introduce yourself, and there's the question on malaria. Thank you.
All right, thank you so much for giving me this opportunity. My name is Yamba Jose. I am the Executive Director of Better Earth International. It's a non-governmental organization that is based in Cameroon. We are here in Boya. The reason why I'm very much interested in this program, Teach to Reach, is because here in Cameroon, we are basically facing a lot of challenges with malaria. Because in the area of health, the government has made commendable efforts for children between the age of 12 to 23 months to give them, of course, free malaria care. And of course, for children which is also below the age of 5. But the challenge here in Cameroon is that there is a lot of infant mortality because the children between 0 to 5 years are actually experiencing high infant mortality rate, which of course stands at 62 per 1,000. This was the case in 2018. We're experiencing this, of course, dropping, but there's much that needs to be done here in Cameroon because we actually having a lot of issues with poverty, which of course pregnant women, lactating mothers do not have easy access to better health care. And that is why the infant mortality is actually on the rise. The strategic objective that was set by the humanitarian response plan has as objective to reduce mortality and morbidity for 1.5 million people, and 52% of these are children. And so what we've been doing here in Cameroon is, of course, to improve the situation of access to better health care for pregnant and lactating mothers, because with our organization, we have as a responsibility to improve access to basic health care, improving access to nutrition and essential supplements. And we are basically doing some screening for nutrition. We are also doing some testing for malaria and HIV. And we've come across a lot of women and girls, especially in the conflict-affected communities in the Northwest and Southwest, where women and girls do not have easy access to healthcare as a result of the conflict. And so our reasons why we want to join Teach to Reach is, of course, to mobilize our resources. It's also to improve the aspect of women gaining access to better healthcare and, of course, fighting malaria in this part of the country where conflict has actually ravaged our health facilities and institutions. And so that's the reason why we want to join this course. And of course, and make sure that women and girls have access to better healthcare as far as malaria is concerned, and to reduce infant mortality. Thank you, and over.
Wonderful. Thank you very much indeed, Yamba Josue. Now, we've launched the invitation. The invitation is still open to become a Teach to Reach partner. whether you're part of a national Ministry of Health team, whether you're a country or regional partner, or a global partner, civil society organization. It may be a little bit late for Teach to Reach 10, but Teach to Reach 11 will be coming soon. We do want to mark a pause here. We're at the halfway mark for this check-in. And before we give you the critical information, the next steps, and the specific call to action for today's partner coordination check-in, wanted to really honor all of the organizations. We're going to show them briefly on screen. You see, do not panic if you do not see the name of your organization right away. We do have all of the organizations that have expressed interest here. And there's several screens, in fact, so this will take more than a few seconds. This will give you a sense of the huge diversity of organizations from all over the world that have joined, that have expressed interest and will soon be confirming their partnership. So you can see here many different kinds of organizations. We're bringing them all together because we believe that the challenges of global health today require us to find new ways to learn, to know, to come to knowing, and to lead change that is needed. And we're pleased to see 1,829 organizations respond to the initial call for expressions of interest. This is the next to last check-in, the final check-in for ahead of Teach to Reach for partners will be in June, and then we're really counting down. We're today 44 days away. You can see, all right, we've got 4 more screens with the names of organizations. A very impressive list. We hope that you see your organization up there. Will be, of course, featuring every organization far more prominently as we move as we count down closer to Teach to Reach. All right, so as you know, Teach to Reach 10 will be focused on the front line of climate change and health, but that is far from all. With a number of high-profile topics that will be exploring health professionals on the front lines of climate change, the experiences of health workers in the fight against malaria, engaging communities to take action to combat neglected tropical diseases, gender equity, and there are all other relevant themes that partners can support, such as themes and groups such as women who deliver vaccines, neglected needs of women's health, Immunization Agenda 2030, the open source manifesto for global health, and then there's sort of also cross-cutting sort of Teach to Reach functions. So if you are interested and concerned about female genital schistosomiasis, for example, which affects 56 million women and girls, it will be one of the neglected tropical diseases on the agenda. We're getting very close to, and we'll be I would love to be able to tell you today, but I can't, to tell you about the new global partners that are joining, in particular around neglected tropical diseases and malaria as well. Teach to Reach, of course, is still being held under the banner of the Movement for Immunization Agenda. So you'll be hearing from Immunization Agenda 2030 leaders implementing what they are doing to make a difference to help achieve the immunization goals by 2030. And all of this, really, the connecting thread is what we call the Manifesto for Global Health. So this is a document developed with contributions from over 1,300 health workers. But where we are right now in the Teach to Reach process is with the Teach to Reach questions. And so you'll be receiving, if you register for Teach to Reach, if you request your invitation, you'll be receiving questions by email with links. You click on each link and that will take you to the question. You can share your experience, and then on a regular basis, you'll be receiving the experiences that have been shared. And this is how the learning process actually starts, with even before the event in June. And it's different from, say, sitting in a webinar, listening to a global expert make a presentation, but it's actually a very powerful way to learn. And we hope that you as organizational leaders will not only, we of course expect you as leaders to respond to Teach to Reach questions, but we also expect you to and invite you to share the Teach to Reach questions with your members, with your staff, with your volunteers, and encourage them to engage as well. To give you a sense of the power of these Teach to Reach questions, we published for Teach to Reach 9 the shared experiences. And what's in the shared experiences, these are available online. Just type Teach to Reach 9 questions or Teach to Reach 9 shared experiences. You'll find the compendium. You can see there were, for example, on zero-dose children, 302 contributions, 302 Teach to Reach participants who shared their experience on measles outbreaks, 308 immunization staff who shared how they responded to measles outbreaks, what worked for them, what did not work for them. So this is really a unique and a different way to learn, but a very powerful one, because these shared experiences really provide quite deep insights. So that is where we are today with Teach to Reach. Let me just have a look to see if there are questions in the chat, and maybe I'll ask Maria, is there anything you'd like to highlight or add?
Well, I would like to encourage everybody to join and to tell us what other critical challenges you're facing and other things that you would want to see or you would want to discuss with your colleagues in Teach to Reach. That is also something that we're looking for. And I see that there's still a hand raised of, okay, Michael, if you want to unmute for a very short period.
Okay, let's do it. But all right, go ahead, Michael. Yeah. Do introduce yourself.
Thank you so much.
Don't forget to say where you're from, where you're based, and where you work.
Yeah, thank you so much, Mr. Reda Sadiq. My name is Okech Mike from Uganda, Eastern region. I'm one of the health workers on the front line that do interact with a number of patients, both adults and children, suffering from malaria. In fact, for the period that Uganda has taken, malaria has been a very big burden and actually has affected all ages, children, pregnant mothers, and even elderly. As we report now in my region specifically, for the years that I've been in service, I've realized fighting malaria is very easy, just in case someone took the responsibility and played the part he's supposed to play. For example, being a health worker, if you have taken enough time and really embraced preventive measures, those ones including health education of our mothers, health education in schools, health education in mothers that bring children for immunization. When they embrace that message you give, really preventing malaria can become very easy. There is a question, how has it affected our community? Really, we've lost a number of children, a number of adults, but it has been as a result of some reluctance in embracing preventive measures. That is very, very clear. For example, miscarriages that we register at our facilities on a daily basis, mortalities of our children under 5, and then frequent admission is due to anemia. Most of them, when you assess critically, they are brought about by severe malaria. So what have we done to help our communities? For us, we realized that if we empowered our community health workers, those are the village health team, with identifying the signs and symptoms of severe malaria, signs and symptoms of complications of malaria, and then refer these patients, including mothers, in time, really life can be saved. So what we did was to first train our VHTs on how to test and treat malaria. So from the time we started that, in fact, the number of malaria cases registered at our health facilities has really gone down. It is very unfortunate that I've not remembered to carry these statistics, but the fact is the number has gone down. The VHTs have done a very good job at community level when they identify a patient with the signs, do the testing, and then if the malaria is not severe, they give the oral antimalarials. Then if the cases are severe, they refer to facilities as early as possible. Then another thing we've done is that we've embraced the policy set by Ministry of Health of test and treat at all health facilities in the country. And really this one has helped us to save those drugs, those antimalarials that we use to give to patients who did not qualify to get any antimalarial, they have been saved to treat those ones who really qualify, who have been tested and they have tested positive for malaria parasites. They are the only ones that are given antimalarial. So in the due course, we've realized there is a lot of antimalarial medicines that have been saved and used on the right patients. Slightly and briefly, that is how we've been able to help our communities to fight malaria and contributing to Ministry of Health strategy of fighting malaria in all ways. Thank you so much for the opportunity.
Thank you very much indeed, Michael Okech. And this is informal. This is between the leaders of organizations, leaders like yourselves. But you'll soon be receiving on your inbox a set of detailed questions about how malaria has affected you, how you're responding to it, what you, your organization, your community are doing about it. And that is what we call a Teach to Reach question. There will be a series of Teach to Reach questions that you'll receive over the coming weeks as we count down to Teach to Reach 10. And we invite you as organizational leaders, your organizations, to really encourage your members, your staff, your volunteers, community members that you work with who are able to participate in these types of in this type of initiative to also register for Teach to Reach and answer those questions. What I heard, Michael, was so much experience, so much tangible real world experience, and Teach to Reach 10 is about sharing that experience across borders, across challenges to really meet, network, and learn as we progress with Teach to Reach. So now we're actually over time. We realized we initially scheduled these partner coordination check-ins to be just 30 minutes. We're respectful of your time. It felt after the 4th of April briefing that there was such a thirst for leaders of organizations to share what your organization is, what you're doing, how you're doing it, what difference you're making. We wanted to spend more time. We didn't properly inform or explain this. So some of you, I can see there's maybe 10 people who left at the half hour mark. But we're really grateful that you're all still here. We now want to actually tell you what are the next steps for shortlisted Teach to Reach 10 partners. So if you have been shortlisted as a Teach to Reach 10 partner, you have already received a link a message that should have arrived to your inbox. Make sure it doesn't go to your spam. If you do, mark us as safe sender and not spam. But here are basically the 4 steps, and I'm going to invite you to actually do these. So if you're here in the Zoom studio, that's the registration link, so you don't need to register again, and you can actually skip to step 2. And so I'm going to the step 2 is actually about sharing the announcement of Teach to Reach 10 questions with members, staff, volunteers, a community served by your organization, your organizational networks. I'm going to first start by sharing with all of those who are in the room the link. So it's a strange looking link, but if you click on that link, it will share the Teach to Reach 10 invitation on WhatsApp. So that's a very incredibly easy way to do it. I'm actually going to demonstrate. Let me see if I can demonstrate how that works. So here, you just click on the link, and you can see here that this will send your personal invitation. Actually, there is a mistake there. It says Teach to Reach 9. That should be Teach to Reach 10. Apologies for that. Let me see if I can fix that very quickly. Teach to Reach, here. Let's try again. So this would be the corrected link. We don't want to be sharing the link to register for the old Teach to Reach. Let me try that again. All right, so to Teach to Reach Connect. So that's the first link, and this is something you can do right now. If you're with us in the Zoom studio, you would be able to do this right now. The second thing would be to go to, for those of you who use LinkedIn, is to actually go on the on LinkedIn, and I'm going to show you how that works. So I'm actually doing it right now, as you can see here. And so here you have the announcement of the Teach to Reach questions. So this is what we launch as we count down to Teach to Reach. So we explain what are the Teach to Reach questions, and of course there's the link to request your invitation to Teach to Reach 10. So let's see if there have been. Okay, there have already been, as you can see, a significant number of individuals. Let's see who they are, and we do look. And so the invitation for those of you who are in the Zoom studio is to actually go right now. You can click, even if you're on your phone, you should be able to go to LinkedIn. And then I'd like you to do 3 things. First is a like. Second is a repost. So you can just repost. This will share on your own thread. And then third, and this is the most time consuming part, I am very pleased to share this. And I see that Professor Becky Tagbo, whom we heard from earlier, is actually there and says, one of the largest world movement on immunization, join the revolution. Thank you so much. That's a beautiful message. I'm going to like that. And I invite you to do the same. Now, if you prefer what's called X or Twitter, we have a link for that too. We really try to meet you where you are rather than saying you have to go to this or that platform. So let's go to Twitter. And this is something you can do. If you're in the Zoom studio, go to the chat. If you're watching on the live stream on YouTube or Facebook or wherever you are, just search for the Geneva Learning Foundation or search for Teach to Reach 10 questions, and you should find these posts, and then you can do the same. So here, it's the same information, but some people are on X or Twitter, other people are on LinkedIn. So here, again, what I'd like to invite you to do, and if you have a social media manager in your organization, if your organization has its own accounts, please, we invite you to follow us. We'll of course follow back and grow the network really around Teach to Reach 10. So next is to repost, and then finally to actually, in this case, I'm from the Geneva Learning Foundation's account, so I'm reposting myself, and then add a comment to that. So that you can also do the same, I believe, on Instagram. Let me go there. So this, I'm now in my personal profile. So again, you just leave a comment, and then here on Instagram, there's some other things. If you're used to Instagram, I don't know it very well, you can actually share it with your colleagues. And Maria Musa, who says, I have done that already. Thank you so much. We've seen a massive amount of sharing for Teach to Reach. Now, if your organization has a website, a newsletter, a WhatsApp group, you can download the Teach to Reach 10 visual. And then last but not least, because we're going to be posting a lot of these answers to Teach to Reach questions, I think the main reason, this is not about the Geneva Learning Foundation, but instead, if you go to, for example, our LinkedIn, what you'll find are experiences. And right now, you'll find experiences shared for World Immunization Week. And so here you can actually learn by reading the experiences of health professionals from all over the world who are sharing their experiences, as well as announcements and news and updates and so on. So right now also, Maria is actually coordinating a campaign that we're doing for tomorrow's World Immunization Week event. And so you can find that here. It's called It Takes People to Make Vaccine Work, and you'll find some really interesting photography shared by immunization staff from all over the world. All right, let me see. Okay, let's check in here. Zozimo Empatswenu Mugabo says, thank you for your initiatives. Thank you, Zozimo. We look forward to seeing your organization as a Teach to Reach partner. Endayo Iwat, thank you for sharing, as always, on WhatsApp. Olaide Oilaja, ongoing. And Christopher Malou says, what is the topic that you'd like to discuss at Teach to Reach 10? Strengthening governance and accountability for accelerating coverage and transforming services for malaria and other infectious diseases of poverty in Enugu State, Nigeria. That sounds quite specific. There's obviously a very large Nigerian community around Teach to Reach, and there's also an opportunity to connect with others from across the borders to neighboring countries and other countries affected by malaria. So really, the next step then is to follow the Geneva Learning Foundation on LinkedIn, Twitter, Instagram, Facebook, YouTube, Telegram, wherever you are, wherever you go, you check in, you read news and so on. You should find the Geneva Learning Foundation. For Lasane Pugwa, who wants to know, can we send the WhatsApp link? It's actually in your inbox. If you've been shortlisted as a Teach to Reach partner, you should you should have that. All right, there's an amazing message from Mutana Gukaru from the Gavi CSO constituency, a very large network of civil society organizations involved in immunization. Wonderful to know. We'll definitely send over and follow up, and would love to coordinate with you to really open up this opportunity for the Gavi CSO constituency. All right, and then last but not least, I'll show you this final step is actually, let me see if I can share the link, but don't do this until you've actually shared, and that is what we call the dissemination register. So if you follow this link, you'll see that we're asking you to tell us how you are helping us reach your colleagues. And in some cases, we've seen some very enthusiastic people. Oh, wait, I realize let me go back to sharing here. Yeah, so let me start that again. And I realize we're running up into the French language briefing. I'm assuming Charlotte is here. Yes. Okay. So, so we ask you to tell us how you're helping reach your colleagues, and you can see it takes really just a few minutes. So, of course, the program that you're helping to disseminate is Teach to Reach. How many people do you think this can reach? Now, be careful here, because we've seen some people, from some countries more than others. I shall not name any countries. Say, I have reached 1 million people. And then when we looked at the actual registrations, there's 2 people who registered. So we think, okay, well, you can claim whatever you want, but it'll be more helpful if you give us a realistic figure than something that is aspirational. So let's say I have shared on my I think on my Twitter feed, I have maybe 1,200 followers or something. I'm not a big social media user personally, but I do it, of course, for my organization. And how did I share the announcement? Okay, so I'll put Twitter here. Who are you reaching in this way? My followers, I guess. Relevant links. So I'll share my my own Twitter. So I'll share my email address, my name, and so on. And why do we ask for your email address and name? This is so that we can, at the Teach to Reach 10, and before and after it, we can honor you for having supported the dissemination as a partner. And in this case, we'll be honoring you as an individual, but we'll also be honoring the organizations that have really helped to amplify this call, because this is your event. The peer learning is focused on learning from your experience, and it's not about sharing with us at the Geneva Learning Foundation. It's about very much sharing with each other. All right, I see many more messages. Okay. Oh, okay. I do see a good question from Charity Chiptoris. What's the purpose of reaching out to others? Kindly give us the sole reason. The reason is simple. Charity, is that this is peer learning. So the more people share their experience, the more people contribute, the more we can learn from one another how to make a difference on the challenges, the problems, the issues that matter to us and to your organization, my organization, each of our organizations. And the salam back to El Hanifi Isilmu from Mauritania. I think we've reached the end here. We have less than, actually just a little bit over 5 minutes to get the French briefing for local partners started. Once again, thank you. Look forward to seeing you. The next partner coordination check-in is in June, of course, and there we'll focus on the practical aspects of really everything you need to know for your organization to successfully participate and get the most out of Teach to Reach for yourself, for your members, for your staff, for your volunteers, for the communities that you serve. Once again, thank you. Look forward to engaging with you, and thank you so much to Maria and Charlotte and to the rest of the Geneva Learning Foundation team. And yes, the more people are reached, participate in Teach to Reach, the more learning, the more impact we can achieve together. Thank you. And for Adease Odutayo, who's concerned if we're not into gender-based violence, Teach to Reach participants bring the issues that matter to you, to them, to the table. And the Teach to Reach agenda, the Teach to Reach, what we learn is shaped by what you bring to the table.
Okay. All right. Okay.